Hello, friends. My name is Dr. Cameron Bassett. I am a board member of the Storyteller in the World nonprofit organization, and I wanted to put together hopefully a helpful tool for you about developmental milestones and how and what you can do if the children that you're working with aren't quite reaching those milestones. So first off, here's what you can expect to learn. You're going to, one, expect to learn what developmental milestones are, what the appropriate age is for these developmental milestones, and then what to do when your child hasn't reached those developmental milestones. And then if you get to a point that it's not working, what you should do to seek further medical personnel to become involved and help you with this. But the big thing I want you to do, I want you to think to yourself that you can do this. And we, from Storyteller and the World, would like to be able to help you with this. First off, developmental milestones are important because these are what they have found in studies about what is common for children to be able to perform at a certain age and specified age. It is estimated that these developmental milestones are actually underdeveloped, that there are 200 million children under the age of 5 that potentially don't reach those milestones. And so, and this developmental delay can occur through many different things: nutritional deficits, environmental factors, or even inadequate cognitive interaction. So things that would help, that would reduce those things, would be actively involving these children in their environment and also with those around them. So here's what it may look like. You have children that are around, sometimes infants, sometimes toddlers, sometimes children, where their movements just don't seem very well coordinated. They aren't age appropriate. They aren't able to do the things that they would like, that other normal kids would be doing. They'll also have slowed response. So when you ask them a question, sometimes they're a little bit slower to be able to respond to you. They have difficulty focusing. So when you have an object in front of you, typically a child, or in front of them, typically a child will play with it and will help um, explore it and understand how it works and what it does. But these children have difficulty focusing to where they don't really explore and understand it that much more. And then they'll also have a withdrawal demeanor, meaning they tend to sit back and stay back, and they're not interacting, they're not touching things in their environment, they're not putting things in their mouth, they're not crawling around, getting an experience of what's going on around them. And so what we're going to discuss today are some basic milestones, physical milestones that these infants and toddlers should be able to perform and do as they're developing and growing. And I have here a list of the months by which these children or these infants should be able to perform these activities. And we're going to go through each of these more specifically so that you can have a better understanding for it. So first off, we're going to talk about from the infant to the toddler age group. The first prominent movement milestone that infants will go through is what's called prone puppy propping, PPP. So this is when they're laying on their stomach, their elbows are underneath their shoulders, and they're lifting their head up, trying to explore the world from laying on their stomach. And if they're not doing this by about 4 months, then this is when you would be able to intervene and be able to help them out. First, get them some time on their tummy. A lot of children's infants may not like this, but you want to let them start on their tummy. And as they're laying there for a little bit, what you can do is you can move their elbows so they're just underneath their shoulders. And you can hold that there. So have your hands on the outsides of those elbows, so that way you can hold them and support them in that position. You probably want to do this first for about 30 seconds. They may not like it for very much longer than that. And then each day or every other day, add some time to it. A good round number would be about 10 seconds. If you can add just about 10 seconds or so every other day for a period of time until they're able to do it on their own, then that will be a good place to start for them. Now the progression or the next step to that is when they're prone or on their stomach with their arms extended. So they're holding themselves up. As you can see in this top picture, this infant has one arm almost extended. He's trying to look around and try to see what's going on, but not quite there yet. Whereas in the second picture down here, we see the elbows extended. The baby is looking off to something that's higher up, something that's a little bit more elevated, that's drawing his attention. And this is typically done by about 5 months. Again, if they're not holding this, what you can do is you as a therapist or as someone helping them out, is you can put your hands on the outside of their elbow to support them where those arms are straight out in front of them on the ground, and then hold that for about 30 seconds, and then try to hold, give them a break, put another 30 seconds on, and then try to build up to about 3 minutes. If they can start doing this for about 3 minutes, kind of holding themselves up, looking around where they can do it on themselves, not necessarily extended for 3 minutes, but doing it on them for themselves, then you're kind of at a good stage, and they're probably ready to move on to the next milestone. So the next milestone is rolling. Now this is a great one because this is the first movement milestone where they're actually trying to get from point A to point B, or they're moving from one position to another position. So typically what happens, our babies will push themselves up and roll over from their stomach to the back, is usually what happens. Occasionally they'll start with going from their back to their stomach, but that's just not as common. If they're not moving or making this roll by about 6 months, this is when it would be a great time for you to step in and to help them out. So what you would do is you'd place the baby in their side lying position. So this is where they're laying on one side, just like this. And then you put a toy out in front of them, right over here, and you have them reach for that toy. And that small movement is a portion of rolling. So this would be, if the toy was in front of them, it would be rolling to their stomach. So from the back to the stomach. And so you would progress that, you would improve that by moving the shoulders back just a little bit more, and then having them reach just a little bit farther for that toy. And if you can keep engaged with this activity for about no more than 3 minutes, because the baby will probably lose interest by that point. But if you can keep that engaged, then by that time, as you're increasing the length of what they have to reach to, they will be able to do it on their own, and they'll be able to eventually move in the opposite direction, however that works, whichever one they start with. Okay, the next one is the baby sitting on their own. So this is a great one because then they start to engage with the environment in an upright position, which is what they'll end up doing for the rest of their life, for most of their life. And so typically they want to do this by about 7 months. If they're not doing this by about 7 months, then what you want to do is you want to place the infant or the baby in the seated position. Put some pillows all around them so that way, because they're going to fall over, but you want to make sure that they have a cushioned fall. And if you put those pillows all around them, they'll be able to sit up in a safe environment. And what you can do is you can put your hands at their hips to keep their trunk supported so they're in that upright position. And you want to start by doing that for a couple of minutes for the first couple of days, add a minute every other day or so as the baby is able to tolerate it. And then put toys in front of them so that way they can start playing with the toys and interacting with the toys. And you'll find that they'll be more engaged with the environment around them as they're sitting up. Now the next transition milestone is when they're sitting on their bum and they transition to a quadruped, so when they're on their hands and their knees. Typically this is done before 8 months because they want to start crawling, or creeping is what it's actually called, as they move. But here they're sitting, they lean forward, so bring the opposite hand forward to that side. They'll put one foot on the ground and they'll bring their knee forward. And then as they progress forward, they'll reach further with this hand. This knee will come up to where it will be on the ground, just as we see in this last picture down here, where we've got hands on the ground and knees on the ground. And so they're ready for the next phase. What I would do is I would help them bring that opposite arm to the ground, and then I would lift at the hips. Okay, if you facilitate that movement, that will help them learn that they're going to move their hand and lift their hips so they're on their knees. Okay, practice this for no more than 3 minutes. So keep it lower than 3 minutes or 5 attempts. And then if they're not quite getting it, take a break, come back and do it again. And then creeping, which a lot of people call crawling, this is when the first time the baby is actually making intentional movements to a location. So this is very important in their milestone ages. If they're not moving by about 10 months to go and seek for an object, this is when you'll intervene. And what you can do is you can put your hands kind of around their torso here, and you can move one arm forward and then move the opposite leg forward, and then move the arm in front of them forward, and then the opposite leg forward, to where you're creating this alternate pattern that they're imitating the crawling. And as you do this and you progress it, they will become a little bit more engaged, and then they'll be able to start, as they see fit, start going to objects. And that would be a great way to add into this, is putting objects or toys on the ground for them to go and seek and try to get those. Okay. The next one is getting to standing. So when they're in standing, when they're creeping and crawling around, they'll usually find a side of their table or a couch, and they'll stand and they'll pull themselves up to that. And then here is a point where they're standing alone, and when they're standing, they'll hold that object. And this is a good point for balance. This is where they can stand and play with a toy while standing up, and this supports and gives strength through those bones of the legs, also helps develop those muscles in preparation for walking. And so one way that you can do this is if you support the child at their chest or at the torso and hold them upright where they put their feet on the ground. They may have a reflex where they'll bring one leg up, just kind of out of reflex, but try to keep it to where they're flat on the ground, to where they're putting their feet on the ground. And you probably want to do this about 30 seconds at a time, take a break, and then come back and do it again as the baby becomes more interested in it. And then the last part of the infant stage is walking. Now this is when the infant or the baby will progress to a walking where they're moving one foot in front of the other. And as you can see from this child is taking slowly, they're standing there, they're moving side to side, and then they start making steps. You can see that their hands are high above, close to their head, and they're taking small steps. This is completely normal. They will fall, and that will happen, so make sure that they have somewhat of a safe environment, that if they do fall, they don't hurt themselves. But one thing that you can do to facilitate this, if they're not performing this by 14 months, is if you put your hands again on the torso, right here on the sides of the torso, with your fingers pointing down to the hips. What you can do is with your fingers, you can push one hip forward as they move, once they take a step. Then you can use your hands and your fingers on the other hip to move that hip forward. And then as you're holding them in this position, you can help progress one step in front of the other. And this will be great. It's really tough and taxing on infants. So it's very good to space this out and make some time. But as you do that, you'll find that they'll be more engaged with the world around them, because they'll realize, I can do more. I can get to more things. One thing that really helps facilitate this is if you have a table or a chair or something that's higher, and you put an object on top of that, then they'll want to move to that object to go and get that. Okay? Once they start walking, they are now transitioning from the infant stage to what's called the toddler stage. In the toddler stage, this is when they're walking around and they're progressing to get to that stage as what we would consider a kid. So one of the first things that we do in the toddler stage is kicking a ball. So in this picture, you see this child that kicks the ball. Now this child is a little bit more than 18 months, so the performance may not be quite like that, but the form, as you can see, was actually not too bad. And so one foot comes forward while the other foot is trailing as they're reaching forward to kick that ball. Now, to get this started, you'll place a ball on the ground in front of the toddler, and first just have them walk through the ball. You know, they're going to think they're going to kick it, and have them walk through the ball and give them some encouragement. And then as they are walking through the ball, they feel the contact with their feet and they're able to stand, keep standing. Then what you can do is you can have them supported with your hands again, right at the torso right here with the fingers pointing down, and you can have them kick the ball. And as they kick the ball, as they progress the leg forward, you may have to move that leg forward for them. But then as they kick the ball, then they're going to get a feel for it. And then you can do that for longer periods of time. And you can even set a goal in front of them where they're trying to kick the ball into the goal. And they'll learn to think it's quite fun. Now the next one is a toddler is standing, but then they reach down to pick up a toy. Now reaching down to pick up a toy in the squat position is actually one of those things that's very difficult. Sometimes they'll sit down to grab it, or sometimes they'll get on their hands and knees to grab it, or they won't be able to get back up. And so what you could do is you could start by placing an object on a chair that's a little bit higher. They can pull that down. And then maybe like a little stool that's quite a bit smaller that they have to reach down just a little bit further to get that toy. And then you could even go down just even more closer to the ground, or even on the ground as they're picking up that object. And just encourage this as regularly so it keeps them focused and engaged. At this age, being about 2 years old, they're probably not going to last more than 2 minutes. So try to keep your sessions less than 2 minutes, and you'll find that they'll be better engaged the next time around when you get working with them. Now here is another one. It usually also happens around 2 years of age, but jumping. So jumping with both feet leaving the ground at the same time. A lot of times you'll see infants that will jump and only have one foot leave the ground. This one shows that, or this toddler is jumping and both feet are leaving the ground. One thing to start with that is, we'll watch that video again, is that you can place your hands again on the sides of the torso with the fingers pointing down, so you're supporting the chest and the thorax. And then, or under the armpits, if you are grabbing close to the armpits, not so much the arms, but closer to the armpits, then you can help them. You can lift them up so both feet are cleared and place them back down. And you can do that slowly. You can also place an object on the floor and show them that you want to jump over. Now they won't quite get to that stage till a little bit later, but that helps to give them a visual of something to get over, to jump high enough to clear. And then eventually they'll be able to do that on their own. And something that also helps with children at this age, or toddlers at this age, is music. Having music will get them engaged more so. The next one is when a child will stand on one foot. So standing on one foot is sometimes a little bit hard conceptually, as it takes a while for this child to get to it. But if not by 3 years of age, what you can do is you can also, again, support them under the armpits or grabbing their torso. And then you can help lift up one leg. And as they lift up one leg, they'll get a feel for what it is to stand on one leg. Do this about 5 times, maybe 30 seconds at a time. And then eventually they'll be able to start doing it on their own. Now this is great for balance, and balance is important for a lot of our mobility tasks that we do in life. And so that transitions us to the next movement thing. So that was a static balance, but we need that to get ready for the next balance, which is an active balance activity. So this is galloping. So galloping happens when you have the same leg in front that's leading out. So watch that again. So that left leg in this child is in front. And so as they are skipping along or galloping along, they have one leg that's trailing and one leg that's in front. So if they're not doing this by about 4 years of age, you want to try to start incorporating that and educating first teach them how to do it. That one leg stays in front, the other one trails behind, and have them hop around. This is a great way to also involve older children to come in and show, because showing is sometimes the best teacher. And then also have a big circle. Children love running around in a circle. So if they're going in the circle doing a gallop and they're doing it together, maybe even add a little bit of music, that will also help them be further engaged. And then lastly, one of the milestones that for movement patterns that we're going to discuss is by about 5 years old, they should be able to start skipping. Skipping is when you have one leg, both legs will leave the ground, but one leg will come up, land, and then trail behind the other. One way to help with this is also supporting under the armpits or the chest and have them lift one leg at a time and then put that down. Okay. Um, Another great activity to have with other children involved, especially older children, to kind of show them how this is done. So these are the milestones that I found would be beneficial to help with children from 0 to 5 years of age. Um, Beyond that, typically more engagement, more interaction with these same activities will help them develop appropriately as they move forward. And so I hope you found this very helpful. Here are the references I used to help you understand that this was founded on research and that these are things that would be beneficial and helpful for most of your children. So enjoy, and I hope you've enjoyed listening to this story from the storyteller of the world, and we hope to see you another time soon. Thank you.